go to your patient's room, introduce yourself, ID the patient, all right, and then verbalize to the teacher what are the indications of changing the dressing, the central line dressing. All right, so if you see dirty, if it's gooey and dirty, then you have to change it, you know. Later, you can also verbalize. I have to assess the insertion site if there's edema, there's redness, okay. If there's like, yeah, any
Purulent discharge.
signs of inflammation like that.
Check signs of
Blood coming out. Oh my goodness. Yeah, so you just look at your insertion site, all right? So you're gonna go, tell your patient, I'll be back, all right? So grab your, I'm gonna get my supplies, so grab your central line dressing, change tray, all right? Pair of gloves. All right. So, first thing that you're gonna do, when you come back over here, of course, you have to open this down. Alright, you're gonna go and open this properly. Alright. So, this is gonna be your garbage container. Just take this out. In between over here are your gloves and your mask. Alright, so this is sterile gloves, and you need to grab to get the clean gloves, right? So you're gonna wear this. I'm not gonna wear it.
Cause who knows, man?
You're gonna wear it, and then you can ask if you can verbalize if I have extra mask. Usually, you can grab a pre-packed central gloves. I mean, mask from the storage room, and you can give it to your patient, all right? Or ask the patient to turn his face to the other side, all right? Because he could contaminate his insertion site if he coughs or you know he talks like his saliva spits there. All right, so you can go like that. All right, and then you're gonna go and wear your clean gloves, and then take the. Usually there's no tape like this, but some hospitals they do put tapes like this. So I have invisible. You can use this one as your garbage, all right? So when I'm wearing my clean gloves, I'm gonna remove this, all right? So when you're pulling this, let me wear my gloves because I feel.
Do you see some blood?
Oh, sure.
No, this one you have to be careful not to yank out the, all right? When you're wearing gloves, it's kind of hard.
Yeah, you're right.
Yeah, it's harder. So you practice with your gloves on because it's kind of harder also. It sticks to your gloves. All right? So, so, slowly, you remove this slowly, all right?
You rip it out right away.
No.
How do you remove it?
I'll tell you.
Huh?
How do you remove it?
It has to be going down, all right?
Just try to hold it. Use
How
one
do you
hand.
remove it? Just make sure that you hold, but you cannot hold this like
Close.
all the way close there, all right? Because it's a sterile area, all right? It's a sterile. So when you grab this little sticky Tegaderm, and you have to like pull it down, all right? Because if you pull it up, you might yank the catheter out, all right? So if you go like this, you might pull the catheter out. So you can remove your gloves right now, you know, Just pinch in the middle and go like this and, right. You know what I forgot before we
What?
start this?
What?
Wash my hands.
Oh, okay.
No,
I
you
did
wa-
wash my hands,
I
right?
saw
You
you
said it,
wash
yeah.
your hand.
You saw me? All right. Alright. So, okay. Once you have your tegaderm out, your old tegaderm, you're gonna assess again, all right? So you can assess again because now you have more visibility, all right? So you check for edema, redness, any pain, you know, you can ask your patient. And then any bleeding, you know.
So how often we do
So-
this?
Well, usually,
7 days.
Oh, 7 days, I remember.
yeah, they
Unless you see.
unless it's dirty and you
Yeah.
see it's like there's some kind of
Where'd you read that?
um,
In the book?
No, he said
yeah,
that.
Oh,
it's
Professor said
usually
that.
like days,
Remember.
like 5 days, 7 days, like that, 5 days. Depends on the hospital's policy. All right, so you're gonna wear your gloves. Okay, well, you're gonna open this first, all right? So because we have to.
are you wearing mask at this right now?
Yes, it's invisible.
Before you even open this.
So make sure,
I
do
thought I
not
saw
put
you
your
open this
finger,
So you
first.
assess twice then, huh?
huh? You open it, but not
Because-
totally open, like totally
Mm.
open, because this are like in between. It's
Just stick
in
to the
between
this
this one, you know.
Hmm?
But don't you
Alright.
wear the mask before you even take the tape out?
Yeah, she wants
Yes,
to see
I
that.
wear
She
it.
mentioned that,
I
yeah.
wear it with yes, I wear it.
Okay.
And it's yeah, when you open this, when you take this out from the box, this mask and these gloves are in between. So
Oh.
you don't have to really like open it all the way until you're done. All right. So once you have just make sure that you have space for your gloves. You can even grab pre-packed sterile gloves. All right. So now you can open this without contaminating inside. Alright. And then you're gonna wear your sterile gloves now. Alright, so I have my sterile gloves on. I'm gonna go first, so get the alcohol swabs. Alright. Peel off this top portion. And then you're gonna clean from inner to outer by circular motion. One swabbing only. Don't go back, alright? So this is usually sutured there, so you can just allow the alcohol to seep through, alright? But no, you cannot go underneath, like you cannot go like this, you know? Alright, so you just go circular motion like that. And then you throw, and then grab the other one. You're gonna go a little bit further from the site, alright? And throw. And then a little bit further, alright? And throw. And the same thing as the Providon, alright? We don't really really show this. We just verbalize because this is like soaked with reddish brown Providon. So
It's gonna stain.
it's gonna stain our mannequin and our bed sheets. That's why you just verbalize. I'm gonna go do it the same way as the alcohol, from in, out, circular motion. And then once inner, and then get the other one middle, and then further out. You just verbalize this one. And then you can pour this, all right? This is also Providon, all right, ointment. And it's also very dark brown and red.
So what do you?
So
where do you pour it?
Why do you
Where do you
need
pour
both of them?
Huh? Because it has a different
Yeah.
sterile. You need to kill the bacteria that needs to be killed by alcohol and at the same time by Providon, you know. Some bacteria, they don't die with the alcohol only, you know.
So you just pour it on the top of the catheter?
Over here.
Which one?
The
Over
lung-
here
the
by
lung-
the
sorry.
insertion site. Insertion site. This one.
Yeah.
This is the ointment. The ointment.
okay, got it.
All right. So you just extra protection, you just pour it over there, alright? Don't do it for real because that's gonna stain our mannequin. So, we have those bio patch, but we don't use it for the test, alright? Those round thing. All you need to get is the Tegaderm, alright? So, the new kit is like 3 times larger than this one.
Oh,
So that's the right one. But this is for practice. So I'm wearing my sterile gloves still. And when you put this, all right, make sure that you start from the middle. All right, and then you remove the air. All right.
It's very expensive.
Yeah. So make sure that you're, yeah, they are. So make sure that there's no bubble over there. When you put this, there is a bubble. So try to show your teacher that you're removing the bubble, like you're pressing it like this, going in to out, all right? You cannot really show this, I can't show it because it's so tiny, like.
Yeah.
But the other one, the one that's in the new kit, it's larger. All right, so you can really show during the test. All right, so you're gonna, with the gloves, it's kind of hard to remove this paper. All right, so remove it nicely over here. Oh, now it's so sticky and. Even with the gloves, it's hard to remove this paper.
Can I have it?
Yeah, you can help me. Look.
Oh, no.
Yeah, this one actually is the art label. You can put your initials, the date, and also the
Shit.
the gauge. Well, we don't need a gauge.
It's there.
Yeah, it's okay. It's there.
Good job.
Good job. Thank you. All right, so you can stick this over here. All right. I don't know. I don't think you'd put the
Yeah.
chevron.
Yeah.
He
So
wants a
those-
chevron.
Yes, yes.
Chevron.
Okay, that's why we have this little.
That's gonna be in the kit too, right?
Yeah,
Like-
it's there's gonna be like tape in the kit, and when you don't put the chevron too near the all right, the
Take it to him.
yeah, the Tegaderm, or underneath the Tegaderm, because it's wrong. All right, so just crisscross. All right.
Oh, that's fine.
Yeah, just you go like that. And then we're gonna go, so there should be, when you do the test, please try to put no bubbles. Try not to put this kind of bubble, alright? Because it's kind of, it's not supposed to be, there's supposed to
Yeah,
be,
Tony, going far, okay?
It's
You
beautiful.
wanna do that one?
huh?
Yeah, he wants us
So
that
one more.
and this one.
And then
This way.
another one,
And then just on top.
yeah, just on top, like that.
So
Alright,
this should be away
so-
from the, I'm sorry, from
Mhm.
this dressing, right?
Yeah, not too close to the dressing.
Level the dressing with the
Yeah.
date line.
Yeah, and then after that, you're done, okay? You just do the chevron. So you just crisscross and then
Yeah.
another one on top.
Yeah.
Right? So, you can even, you don't even have to split it. If you think that it's too hard during the test, you don't need to split it, right? So you just go underneath and then you go like this, right? And then you're done, you're gonna go, how are you? Are you feeling better? Right? Open the curtain, clean up, and then wash your hands, right? And then document what you did. Basically, keep it simple, right?